My name's Corey Hunter, Pain Management in New York, and I'm the current president of NANS. So I'm going to give a talk on, I guess, something that is becoming more and more relevant with a lot of the different therapies that are out there. I think it's a really actually relevant talk to discuss as far as, rather than just having these therapies compete with each other, finding the places where they work. Just really briefly, I'm going to kind of go over a little bit about like what's out there, and then cover something I didn't think was really particularly relevant probably a couple years ago. Was like the different features that are available with some of these devices, not so much as it pertains to the evidence-based therapy, but what differentiates them, and then the approach to how to think about it. So this is how it all started. The concept of the gate theory, A delta C fibers kind of drowned out by the A alpha and A beta fibers. And then this was good for a long time until 2015, and then everything kind of went on its head with all these different other therapies coming out.